The interesting part about this study is that we managed to access patient data that includes measurement of inflammation marker, CRP specifically, over a period of time. Most studies thus far have assessed the importance of CRP in a single measurement. Interestingly, of course, these biomarkers in the blood, they sort of fluctuate over time. So we set out to study what it means for someone to have a CRP that's maybe high in baseline, but then it may either convert to low or remain high and follow up. And this is kind of over a month or so apart. So we're not really talking about CRP over the same hospitalization, but CRP apart, away from the acute event, follow up. So interestingly, we found that there are obviously 4 mathematical possibilities. Your high, 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 low, low, high, and low, low. Aside from these 4 possibilities that are mathematically possible, we found that in general to have a high CRP at any time, that's not so good, and that people who convert into high from low are also not in good shape. So interestingly, my immediate message is that, hold on, CRP fluctuates quite a bit over time. I like to know that, and in my own practice, I would say that the measurement of CRP over time, maybe a year apart sometimes, or if for any reason shorter, could be another way that I would assess the long-term risk for my patients. For example, how to address the question, how am I doing? And that could be yet another piece in this puzzle of how they're doing after an event that they had. Typically, in the follow-up of patients with heart disease, we check their cholesterol levels quite frequently for both safety reasons as well as also for efficacy reasons, to make sure the medications work and to make sure the levels are on target, as well as to monitor the patient's compliance. So far, the levels of inflammation have been a marker of how well people do, kind of in general terms. Just only last year, there was or year or two, I would say, there was a study indicating that a specific inflammation inhibitor may improve patient outcome. But again, due to various reasons, this hasn't come to market, and there isn't much specifically to do. So this way, based on our results, I think monitor inflammation on the longer term and see how that goes as a secondary effect of cholesterol medications, as a secondary effect of exercise and of perhaps other lifestyle measurements the patients take. We can see how the patient assessment may be affected by this result, and we can add another way to monitor patients' well-being over time.